Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today on the show, we have Chelsey Lindner. She is a clinical pharmacist. Her Kevin MD article, which we'll talk about today, is titled Integrated Care is the Key to Optimizing Cancer Outcomes. Chelsey, welcome to the show.
Thank you so much. Yeah, thank you for having me on today.
So we'll get into the article in a little bit. First off, just briefly share your story and journey to where you are today.
Yeah, sure. So after undergrad, I completed my doctorate in pharmacy. After pharmacy school, I did do 1 year of residency in ambulatory care. During that experience, I rotated through various outpatient clinics and also worked with our health system specialty pharmacy. For anybody who might not know, a specialty pharmacy really is just a pharmacy that fills high cost or high risk medications. And oftentimes insurance or the manufacturer might have specific contracting requirements that a specialty pharmacy can fulfill. And health systems can have their own specialty pharmacy, or you might think of some of our big box corner retail stores, they might have their own specialty pharmacy service line as well, which we would consider those a non-health system specialty pharmacy. So after completing residency, I did work with our health system specialty pharmacy in an oncology focused role. The benefit of that health system specialty pharmacy is that you can have a pharmacist or a pharmacy technician right in the clinic, meeting face to face with the patients, the providers, the nurses. Really just helps streamline communication, improves patient safety and patient care as a whole. After working for a health system specialty pharmacy, I transitioned to working for a cancer center pharmacy and helped to develop and manage an oral oncolytic management program. Really, some of the big things that I did in that role was identified ways to optimize the patient experience when they're undergoing cancer care. And I also helped to create treatment plans for oral cancer medications to enhance patient safety. And then most recently, I came back to health system specialty pharmacy. I'm working remotely with Shields Health Solutions. For anybody who might not know, Shields is a specialty pharmacy integrator. And what that means is they just partner with different health systems across the country to develop and operate health system specialty pharmacy. And so in this role, I work with on-site dispensing teams as well as clinic teams at NYU University, actually, to manage oral cancer medications and other specialty medicines. And I also serve as the oncology subject matter expert for our internal education and development program. So I host various educational webinars and provide professional development opportunities for our staff.
So in your background, when you were embedded with the ambulatory team, tell us some stories or examples about your role as a clinical pharmacist and how that moved the needle when it came to patient safety and the patient experience.
Oh, yeah, definitely. So I'm really passionate about patient care, especially when it comes to kind of the oncology area of focus. You know, these patients are going through a very hard time in their life, potentially facing a life-threatening illness. And I think it can be a very overwhelming time for those patients. And there's a lot of pieces of the puzzle to navigate with their care. They might be on very complex regimens, you know, meeting with various healthcare providers. And so I think having that opportunity to be in person, meet face to face, and be a point of contact and an advocate for them really helped to improve their patient journey as they went through their care. I have, you know, so many patients that would call me up and just ask questions or ask for updates on things. And, you know, having that really easy, open communication with the patient and having been able to meet them face to face, I really think it improved the patient experience as a whole.
What are some examples of some typical questions that you would be asked, either from patients or from the clinicians on the team?
Yeah, so I think probably the number one question I would get is when a patient was prescribed a new oral cancer medication, they would say to me when I walked in the room to meet with them, you know, can I just go pick this up at my local CVS, or this is my local pharmacy, I'll get it there. And so the number one question I would get or have to educate patients about is that these medications, because they are oftentimes both high cost and high risk, they are required to be filled through a specialty pharmacy. So explaining to them that process, that this medication is not going to come from your corner retail store, that we have a lot of kind of pieces that we have to work through as far as getting prior authorization from insurance, They're very high cost medicines, so we may need to, see if we can acquire some type of financial assistance. And then eventually, we'll be able to send this medication right to your home, or depending on the location, they may be able to pick it up in person, or we could bring it right to their clinic appointment even. But the number one question is, why can't I get this from my corner retail store? Yeah.
All right, so let's talk about your Kevin MD article. It's titled Integrated Care is the Key to Optimizing Cancer Outcomes. So tell us, how did this article come together?
Yeah, so as the oncology subject matter expert with Shields, I'm really an oncology point person for our company as a whole. So my marketing team did come to me and ask me to comment on the ACS annual report on cancer statistics about why survival rates are improving, and then presented me with the opportunity to publish on my thoughts, which led to the article. So my initial thoughts is, I know we are seeing increased survival in part due to we have better treatments, we have better screening capabilities, we're screening patients earlier, so we're detecting disease when we can still cure it. We have increased awareness of lifestyle factors that impact a risk for cancer. We have fewer people smoking, but I think also the payer landscape has impacted patient outcomes because a lot of reimbursements for both doctors as well as pharmacies have been shifting from like a quantity focused payment scheme where fee for service, the more patients I see, the more money I get, and now are really trying to incentivize enhancing the quality of the care provided. So we're seeing payment models are shifting to performance based. So providers and the whole healthcare team is incentivized to provide higher quality. And I think one of the big drivers for this is the Centers for Medicaid and Medicare Services. They created a payment model called the Oncology Care Model that was most recently. Now they're switching to the Enhancing Oncology model. And so this new model is really focused to improve the care coordination in oncology care. So I think we're going to continue to see improved outcomes in as far as patient survival. But this is really where integrated care comes in. I think it's really the key to being successful in this new model and continuing to optimize patient care as a whole. So for my article, I really tried to focus on three main areas that I felt an integrated care model can impact positive outcomes. So, the first would be medication access. Difficulty accessing a medication is considered the first barrier to adherence. We have, insurance approvals we have to go through. We have financial assistance. We have potentially pharmacy restrictions. And so having a dedicated team or personnel to manage that step in the process really can help get patients on their therapy quicker. We also can see enhanced patient safety. There's more transparency between the pharmacy and the provider with this integrated model. The pharmacy may be able to directly communicate to the provider when the patient actually starts treatment, because again, remember, this is for oral cancer medications. The patient is just receiving it from the pharmacy, and so they may start taking it before their provider even knows about it. And then we also see that oftentimes the pharmacy or the pharmacist can sometimes be easier to reach than maybe the clinic staff, because they're, they have a lot of different patients, they're seeing patients in clinic and everything. So, having that easier access to a healthcare personnel, can help patients and mitigate side effects. And then lastly, the kind of third area was long-term follow-up. So, a patient may be going for clinic visits initially on a regular basis, but as they're more stable on therapy, may see their provider less frequently. But the pharmacy is generally speaking with the patient every single month to schedule those refills. And so that's a touch point with the patient between these visits where we can potentially identify adherence issues, side effect issues, and we can, escalate or provide supportive care measures to really improve the entire patient journey. So those were the kind of the three main areas that I focused on in my article.
So you mentioned medication adherence, and as a primary care physician, certainly that's one of the biggest issues that we need to deal with. So what are some of the common reasons that you get that sometimes interfere with medication adherence?
Yeah, so a big one would be financial toxicity. So patients may be faced with a very high copay, especially if they're, potentially have Medicare. They might have a deductible to meet at the beginning of the year. And we're talking about, when I say expensive medicines, I mean, 1 month of medication, like the cost could be about $20,000 almost. So when we think about, the patient might be responsible for a small percentage of that, that is still a lot of
Sure.
money. So I would say, the copay cost is really the number one reason, but we've been doing a really great job with getting patients the financial assistance needed through different foundations or getting them set up with the manufacturer patient assistance program. So the majority of our patients, we are able to get their copay down to less than $5, which is amazing and demonstrates the benefit of like a health system specialty pharmacy and kind of this integrated model. But other than that, it could be, patients might not necessarily notice the benefit of taking their medicine because it's kind of like managing a chronic disease in some situations. So they don't really understand maybe the importance of the medication. And then I would say probably the other biggest one is side effects.
Sure.
Okay. So I always reinforce to patients that we don't want the treatment to be worse than the cancer itself. And so, especially when it comes to more palliative care, where we're really just trying to improve survival and kind of enhance their quality of life, that's a big factor. And so, but that's where this integrated care model really is beneficial because we can work with patients to minimize side effects and help teach them about what to expect with the therapy and, when to let somebody know when some type of intervention might be needed. So side effects are probably another big one.
So you mentioned about the oncology care team as an example of integrated care. So specifically with that oncology care team, talk to us about the different roles and different members that would comprise that team.
Yeah. So as part of the health system specialty pharmacy and kind of the oncology care as a whole, so usually with the health system specialty pharmacy, you have clinical pharmacists, you may have separate dispensing pharmacists. So the clinical pharmacists are maybe doing more of the patient outreach and education and counseling. Dispensing pharmacists are, more so doing kind of receiving those prescriptions and doing the actual dispensing of the medication. And then you'll usually see kind of a level of certified pharmacy technicians where, depending on the institution, they may have kind of more structure to that role. Like at Shields, we call them liaisons that are pharmacy technicians. And then we also have patient support advocates. So kind of able to divide some of the responsibilities, but essentially the liaisons are the ones that are calling patients every month to schedule refills and, set up new deliveries for new patients. Whereas like the patient support advocates might be working towards getting that insurance approval, doing appeals, helping patients get financial assistance. So kind of through that, we can, kind of be able to touch more patients because we're dividing up some of that workload. But then, in clinic, then we have, our providers, our advanced practice practitioners, our nurses that are, right there in clinic meeting with patients, and we can easily communicate with them through like our electronic health record or email. And then some institutions may have like financial advisors that may be able to do some of the financial assistance piece, as well as social workers and dietitians, palliative care specialists. Oncology care is really, there's a lot of people involved. And I think, that team approach really enhances the patient's outcomes and just their experience as a whole.
Now, tell us what kind of medical institutions have these integrated health specialty pharmacies. Are they typically large academic medical centers? Are they smaller community hospitals? What are some typical medical institutions that we're talking about here?
So a lot of them are academic medical centers, just typically because they have kind of more resources, more personnel to be able to kind of get a health system specialty pharmacy started. And so all that means is that, that particular institution, like NYU is what team I work for, they have an actual pharmacy, specialty pharmacy on site operated by NYU. And so essentially we can keep those patients in-house, so we have more transparency over their care and their treatment.
We're talking to Chelsey Lindner. She's a clinical pharmacist. Her Kevin MD article is titled "Integrated Care is the Key to Optimizing Cancer Outcomes." Chelsey, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Yeah, I would say that integrated care is really the key to being successful in the new enhancing oncology model. And usually using a health system specialty pharmacy is going to be the best choice for your patient. We see improved coordination of care for both new starts as well as patients continuing on therapy when they use a health system specialty pharmacy. It streamlines communication between the patient, the pharmacy, the provider. We have that enhanced transparency regarding medication dispensing. We do see enhanced patient satisfaction as well as provider satisfaction when they use these health system specialty pharmacies. And we see enhanced patient safety and follow-up. So that's kind of the main thing, is that if you have a health system specialty pharmacy and we can work with this integrated care model, we're going to see better care to the patient.
Chelsey, thank you so much for sharing your time and insight, and thanks again for being on the show.
Thank you so much.